Governor DeWine, thank you so much for joining us here this afternoon. Ohio right now seeing a disturbing increase in coronavirus cases. Given that and the science that says mask wearing slows the spread, are you at all considering an executive order making masks mandatory in public spaces right now?
Well, before we would make anything mandatory, we certainly would talk to local officials, talk to the mayor, talk to the county commissioners, but we're not there yet. I mean, what we really need Ohioans to do is to wear masks. And if we get 80%, 90% of the people who are in public wearing a mask, that's very significant. So we've got to up our game there. We've got to keep the social distancing. We've got to wash hands. And we've got to increase testing. And we've seen in Cincinnati and Hamilton County an increase in testing in the last week. It's something that we're working on with the mayor and the county commissioners and the health directors. We've had the National Guard in, so people have the opportunity to just show up, get their test taken at no charge. And we are urging people to do that. As we move forward, we're going to really be focusing more on giving people the data from their individual zip code, their individual county, city, and we think that's very, very, very important.
You know, here in Cincinnati, we've seen bars, we've seen restaurants close because they've had an employee test positive for COVID-19. Is that the right thing for them to do? And then also, do these businesses, specifically bars and restaurants, have a responsibility to their customers to notify them if an employee tests positive?
Well, they certainly do. They have an obligation to do that, and certainly it's the right thing to do. Any Ohioan who tests positive, I'm sure, wants to be helpful and let people know who they've come in contact with, who might have been exposed. It's just the right thing to do, and it's a part, frankly, of us being able to control the spread of this virus.
Exactly right. Now, given the uptick in cases that we talked about just a moment ago, are you at all close to, are you considering, reinstituting that shelter-in-place order that we had seen earlier for people who are coming into Ohio from coronavirus hotspots across the country?
Well, we would urge anyone who's coming in, we've not made an order yet, but we would urge anyone who is coming in from any hotspot state to quarantine. It certainly is the right thing to do. Someone comes in from Florida. We had a case in the last few days. We had some young people who went to Florida. A number of them became infected. They came back. So that's what you worry about, is that people are out partying. They're out in an area where, the odds of getting the virus are pretty high. And then they come back to Ohio. And then, boom, here we are. And we've got it. Anybody they come in contact with in Ohio risks getting that. So, if you've been in a state like Texas, you've been in a state like Florida, you're coming back, unless you've been out hiking all by yourself, we would certainly urge you to quarantine.
And Governor DeWine, I want to go back to masks just for one more moment here. You said you weren't ready to make it mandatory statewide. Do you think that you would at least encourage local jurisdictions like Hamilton County, where we're seeing this uptick, to maybe look at that on a local level and make it a mandatory policy on a countywide level right now?
I don't think we're there yet to make it mandatory in a city or in a county, but we are looking at this data now from a local perspective. We have good data. Local health departments have good data. We can break this down, down into the zip code. We can tell, who's getting it, not individuals, but we can tell that. But what we're looking at is trends. And so that is something that certainly is possible that we might do in conjunction with working with local elected officials. But for now, what we're asking people to do is look at these numbers. It ought to scare all of us. If we want this economy to move forward, if we want people to be able to work, if we want growth in jobs, then we have to stay tough with this virus. And the only way, there's two ways we stay tough with this virus. One is people staying away from other people, wearing masks, washing their hands. That's number one. Number two is more testing. And so those are the two things that you can do. Anybody who's watching this, go get a test. And at the same time, just be careful. Wear a mask in public, wash your hands, basic things.
And we are seeing more and more people in that age range between 20 and 30 years old right now testing positive. How do we get young people to take this virus seriously?
My message to someone who's 20 to 30 is this. You might think that you can if you catch it, you get through this okay. We certainly have had tragic examples of people in your age group who have not, who've gotten very sick. Some have died. But if you don't worry about yourself, worry about your grandparents, worry about your parents, worry about anybody you might come in contact to at any age who might have a medical problem, because you become a spreader. And you can spread it, you will spread it, and that is risking someone else's life. And there's none of us, I know none of you, would want to be responsible for someone getting really deathly sick.
You know, 4th of July is next week. Obviously, that's a big time for people to get together with friends and family. Do you think that it's the best policy here, or best practice here? If you want to go to one of those gatherings, should people get tested before they go? And then what is your advice and what is your guidance to people who want to have these gatherings right now?
Well, my advice to people who want to have big gatherings is don't do it. I mean, I just don't think it's worth it. I mean, if you look at the spread, we now have significant community spread in Hamilton County and Cincinnati and all throughout Southwest Ohio. Going to any kind of large parties or gatherings makes absolutely no sense. Look, you want to go over, you've got kids or grandkids or parents, and you go over to their house and you're outside and you have a picnic and you stay, some feet apart. That all makes sense. Fran and I do that with our kids, with some of our kids and some of our grandkids. We spread out. You can have a picnic, you can have the food there. You just got to be careful. But going to a party with strangers, going to a party with people who you don't interact with every day, you're just exposing yourself to more people. And so this is hot in Hamilton County. This is hot in Southwest Ohio. This is the part of the state that we are frankly most concerned with, from Dayton down to Cincinnati. So I just would tell people to be careful.
Do you feel like people are going out mixing and mingling too much right now? Are they not taking this as seriously as they should be?
I think it's a natural tendency. As the weather is good, summer is here, and people have been cooped up, and so they want to get out. I fully understand that. I get it, but we just have to keep in mind this virus is very much here. It has not gone away. There's widespread community spread. We know that people who catch this many times are catching it from someone who is showing no signs that they have it and who doesn't even know they have it. So you go out in public, you need to look at everybody that you're coming in contact with as if they have it, because they might have it and they just don't know it. So again, wearing the mask is just vitally important. Staying that distance is vitally important.
Exactly. And Governor DeWine, I'm curious, at what point would you reconsider, closing bars, closing restaurants, and putting in a shelter-at-home order once again, or would you get to that point?
Well, that would be a long, long way. There'd be many steps before we do that. And look, I hope that we can get hold of this by testing and get hold of this by Ohioans putting on the mask and being careful. Medical science is abundantly clear. It's really coming down to what people do. And so in having Dr. Lofgren on today from UC Health, we wanted a doctor who is looking at the numbers in Cincinnati, Hamilton County, and the region to be the one talking to the people of the state of Ohio. This is an area that we're very worried about. He was very eloquent today in basically saying we can get through this. We will get through this, but we have to be careful. We have to be prudent. We have to do what needs to be done.
All right, Governor DeWine, thank you so much for joining us today. Have a good one, sir.
Good to be with you. Thank you.